good afternoon. Welcome, everybody. I'm Victoria Anderson. I'm a Senior Associate in the Health and Safety team at Brodie's. I'm joined today by my colleague, Lynn Livesey, who's also a Senior Associate in our Insurance and Risk team. And we are going to be speaking to you today about the health and safety considerations arising during COVID. I think the best place for us to start will be with Lynn, who's going to take us through some of the legislation and what's happening with that. I will then touch on the aspects of breaching the legislation and the focusing on risk assessments for employers in terms of health and safety duties. We're going to round off the session with some questions. So as I've said, if you do have any questions throughout the course, please pop those in the question and answer box at the bottom. And please do provide your name or contact details in case we don't get to them, but can answer that after the session. So I will hand over to Lynn, who's going to kick us off by looking at the legislation.
Great, thanks Victoria. Well, good afternoon everyone. We're going to look at the legal landscape first that employers are operating in during the COVID-19 pandemic. And the first thing to make clear with that is that UK health and safety law has not changed. It's not relaxed as a consequence of COVID-19. And I've put a quote on the slide there that's lifted from the Health and Safety Executive's website, and it confirms just that. The HSE is continuing to exercise its function during the COVID-19 pandemic, ensuring ongoing compliance by duty holders with existing health and safety at work legislation, as well as taking action against employers who aren't appropriately responding to COVID-19. So by way of reminder then, what are a duty holder's health and safety obligations? Well, employers have a duty to ensure, so far as reasonably practicable, the health, safety and welfare of employees and members of the public affected by the business activity. That's the overarching obligation, and it's set out in the Health and Safety at Work Act 1974. There are numerous other more specific pieces of legislation that obviously sit alongside that act. And one of the key obligations in those pieces of legislation is Regulation 3 of the Management and Health and Safety at Work Regulations 1993. That sets out the duty to risk assess, which, as we'll come on to discuss, will actually be a key tool for employers in navigating health and safety considerations in terms of COVID-19. And in addition to this, employers have common law obligations to take reasonable care for the safety of employees and members of the public. And when assessing whether that standard of care has been breached, a court will generally consider if a business has complied with health and safety law. So breaches of health and safety law can result in both criminal action being taken against a business and individuals, including prosecution, but it can also result in claims for damages. So how does all that fold into COVID-19 and the health and safety regime? There's no doubt that COVID-19 has introduced new issues and risks that need to be considered and managed. The risks arising from contracting COVID-19 is so well known that employers now do have a duty of care, so far as reasonably practicable, that employees and members of the public don't contract COVID-19 as a consequence of an employer's business activity. The timing of when that risk was known will no doubt be the subject of litigation in due course. However, in our view, in the context of mainstream business, and that is if you exclude sort of the healthcare and social care providers, the risk became known or foreseeable at the latest on the 23rd of March this year, which is when lockdown began, as I'm sure we all remember. There are certainly arguments to say that an earlier date would be applicable. So if we turn now to have a look at the legal framework in terms of legislation and regulation, both the UK and the Scottish Government have enacted coronavirus legislation which requires certain workplaces to close. However, with the easing of lockdown restrictions moving at a different pace amongst the devolved administrations, which businesses can operate differs depending on location. So employers need to be carefully considering if they can actually recommence work And if so, what the health and safety considerations are that they need to take into account when doing so. Presently in Scotland, all businesses that remain open have a legal duty to take all reasonable measures to comply with social distancing rules, in particular ensuring that the distance of 2 metres is maintained between people on the premises or those waiting to enter the premises. These social distancing rules in England are not backed by legislation, and we know that there is pressure that the 2 metre distance rule, people are pressurising for that to be changed. In other countries, the distance is less, and there is an argument that by enforcing a 2 metre distance, it is unnecessarily restricting a business's ability to operate. Both the UK and the Scottish Government are presently seeing no justification to change this distance. However, it is being kept under review, and indeed, there's been further media coverage on this very point this morning. Now, in terms of the government guidance, both governments have also issued various guidance notes to assist businesses during the pandemic. And while there are consistent themes throughout, the messaging from the governments has been different. For example, in phase 1, the Scottish Government guidance advises that all businesses, sites and attractions not required by law to close should remain closed, with some exceptions such as businesses that are supporting the essential services or essential to the health and welfare of the country during the crisis. If we contrast that to the UK Prime Minister, who's actively encouraging businesses in England to open if they are not a business that has been ordered to close or their staff cannot work from home. The position will change again in Scotland when we move to phase 2, and the First Minister has indicated that this may happen as early as next week. So what is clear is that the situation is fluid, and businesses need to ensure that they are keeping abreast of developments. Each government has issued industry-specific guidance. I'm not going to spend time today going through these in individual detail. I would recommend that those working in each sector familiarise themselves with the guides which are relevant to them. The slides will be circulated after this webinar, and the links on that slide will take you directly to the relevant guidance for your business. There has been media coverage about individual compliance or otherwise with these guidelines, with Dominic Cummings being the most recent high-profile individual in the limelight. Whilst I'm not going to offer my views on that today, it does lead me to consider a key question. Do businesses have to comply with this guidance, and how does it interplay with the law? A breach of guidance doesn't necessarily equate to a breach of law. The vast majority of guidance is not compulsory, with the exception of some types which may have a special legal status, such as the HSE's approved codes of practice. However, when looking at whether the law has been complied with, courts will often derive assistance from relevant guidelines, protocols and advice. Therefore, the government and sector-specific guidance should most likely be a business's starting point when they are considering what control measures to put in place to keep people safe whilst they're operating their business during the COVID-19 pandemic. And indeed, many businesses are taking adherence to this guidance very seriously. That said, every recommendation in the guidance may not be appropriate for your particular business. The guidance itself recognises that it may not always be possible to meet all of the requirements, and that's echoed throughout the guidance. But where a business chooses to depart from this COVID-19 guidance issued by the governments, it should be prepared to justify the reason for doing so. It's almost inevitable that that question would be asked of the business if they faced legal action. So I therefore strongly recommend that any decision making to depart from this guidance is carefully considered and documented. So that's the legal framework we're currently operating in. But what does that actually mean for businesses in practice? The first topic I'm going to consider is workplace testing. Testing has been somewhat of a hot topic. The eligibility for COVID-19 testing has been greatly expanded in recent weeks, and now anyone who's self-isolating with symptoms of coronavirus can order a home test or attend a test site. And called Test and Trace in England and Test and Protect in Scotland, these are methods of putting a test, trace isolate and support strategy into action, which is designed to break chains of transmission in the community. But what does this mean for employers? Will employers have a role to play in ensuring that their employees are aware of and able to follow these measures, as that's going to minimise the risk of infection in the workplace? So employers should be ensuring that they are communicating with their workforce in terms of what coronavirus symptoms are and what to do if an employee does become unwell with those symptoms at work. Clear procedures should be put in place to ensure that employees know to leave work to self-isolate straight away, and if possible to wear a face mask or face covering, and to try and avoid public transport when leaving the office. Employers should also be directing their employees who develop symptoms to arrange to get tested. And procedures will also need to be put in place to ensure that employees are aware that until they've been tested and it's safe for them to leave home, they're not to return to work. So communication with the employees is therefore key to ensure that this risk of infection is controlled in the workplace. Depending upon the employee's condition, arrangements might be able to be made to enable that employee to work from home whilst they're isolating. And Victoria is going to come on to the health and safety considerations of home working shortly. But what about an employer who wants to test their workforce? Can they do so as a control measure to limit the risk of exposure to their employees whilst they're at work? Well, for the football fans amongst you, you might be aware that the Premier League and certain clubs have been looking at this and actually investing in coronavirus testing machines that will be able to turn test results around in a matter of hours. But these machines are expensive and they can only test one person every 2.5 hours. It's estimated to be costing each club around £100,000. As such, the cost of this type of testing may be prohibitive for many employers. Another method of testing would be to ask employees to undergo a temperature check. However, testing has proved controversial amongst members of the corporate community, and that's mainly due to data privacy concerns. So therefore, the introduction of testing or using things like a health questionnaire to assess potential infection risk with workers or visitors does raise a number of issues for employers which will need careful consideration. And those considerations include, and are certainly not limited to, but how that testing facility is going to operate, how frequently employees are going to be tested, what confidence can actually be placed in the accuracy of the test, who's going to have access to the testing information, and what actual action is going to be taken as a result of the outcome. And so, whilst testing is a potential control measure that employees might want to adopt, but businesses should really think about the practicalities, costs and consequences of implementing such a system before doing so. I'm now going to pass you over to Victoria, who's going to provide some further advice about risk assessing and controlling and consulting your workforce.
Yeah, thanks, Lynn. So, existing duties, as Lynn has said, which are incumbent upon employers in terms of health and safety, haven't been relaxed and haven't been removed. Accordingly, every employer must still comply with the overarching duty to ensure, so far as is reasonably practicable, the health, safety and welfare of employees whilst at work, as well as those non-employees who might physically interact with the business, such as customers, contractors, delivery drivers and members of the public. Central to this duty is risk assessment, and a lot has been said in the media over the past weeks and months about risk assessment, and it has an almost elevated status during the pandemic. The first thing I'd like to look at are home workers. So if your employees remain working from home and you don't consider that they're going to be returning to the workplace in the next month or so, then it's likely that we are approaching the longer term category of home workers. Unfortunately, and somewhat unhelpfully, there is no clear definition of longer term home workers. So it's something which we recommend is considered now, depending on your business's plans for returning to normal. What do you need to consider for your home workers? Well, firstly, you need to consider if they have adequate ongoing supervision and support. Contact needs to be regular and good quality with each individual to ensure that they are supervised and supported If your company's contact with its employees is poor, then this can lead to workers feeling disconnected and isolated, all of which can affect their stress levels, their mental health more generally, and also their general productivity. Are your workers working with display screen equipment? Well, I think the vast majority of us working at home just now are working with display screen equipment. And we did touch on this in an earlier webinar. As an employer, it's likely that you will already have given your employees advice on breaking up long spells sitting at the computer, adopting the correct posture positions, etc. And you might now need to consider asking your workers to carry out an assessment of their workspace. Now, the HSE, the Health and Safety Executive, has a free workstation checklist document which you can send to your employees and ask them to follow and complete at home for it to be submitted back to the employer. Helpfully, this document, which you'll see is linked at the bottom of the slide there, does indicate how far you have to go to comply with this specific duty, and it's also pretty straightforward and shouldn't be any issues for employees completing this themselves. Depending on the outcome of the risk assessment, however, you might also need to consider if any staff members require specialist DSE equipment to assist them. That might be a standing desk, specialist ergonomic chairs or supports, wrist supports, that type of thing. However, if you are starting to plan for returning to the workplace, then you are likely to have either already completed or be in the process of completing your COVID-specific risk assessment. An interesting model from an employment consultancy firm was published during the week, a huge survey which showed that more than 60% of businesses are still to embark on this process. So wherever you are in the process, do take time to double check that you've considered the following questions, which are all based on the Health and Safety Executive's guidance. The 5 sort of key questions, if you like: who is returning to work? How are they returning to work? What work will they be doing? Have there been changes to the way in which that work will be done? And are there non-work related activities occurring in the workplace? So taking each of these points in turn. Employers need to consider who in their workforce can or should return to work. For example, pregnant workers or those with underlying health conditions, those who might live with others who could be shielding. It's important that employers ask these questions of their employees to check that they're not indirectly affecting others who might be vulnerable. And consideration should also be given to whether the full workforce can or should return at the same time, or whether a shift system should be introduced, bearing in mind, of course, any employment law issues which might be associated with changing existing shift patterns. How are people returning to work? Well, health and safety duties for employers have actually been extended by the guidance and advice issued by the governments and the HSE during the pandemic. Pre-COVID, the employer's duty started at the doors of the workplace, but now that includes consideration of your employees' commute to work. Where possible, people should be advised to avoid public transport and to travel on their own by car, bike, or on foot if it's safe to do so. And employers should be aware of how their employees are travelling so that that information can inform their assessment of the transmission risks, but also guide their thinking on what measures might need to be in place on arrival at the workplace, such as hand washing or sanitising facilities at the door, showering facilities. Employers should also consider staggering start and finish times to reduce the number of people arriving or leaving premises at the one time. What work will they be doing? Well, each task undertaken in the workplace needs to be considered and assessed to see if it represents a risk of transmission. You may be required to reorganise the physical workspace in your workplace, whether that's moving away from hot desking, implementing a one-way traffic system for walking, and other factors which will help you comply with the social distancing advice and requirements. Have there been any changes to the way in which the work will be done? Social distancing requirements might mean that certain tasks either can no longer be done or require to be rethought to ensure that if they do need to be done, they are still being done safely. For example, a task which might have required 2 people for manual handling purposes pre-COVID might not now be able to accommodate 2 people in terms of social distancing. So if you have changed how that task is going to be done, then it's important that you reassess it from a health and safety point of view in case the risks associated with the task have also changed as a result of your adjustment. And finally, the non-work related activities that are undertaken in the workplace. Again, this might require a wider focus than pre-COVID risk assessments. For example, communal kitchen areas and canteens will need to be reviewed to ensure that transmission risks are as low as possible. Removing communal crockery, cutlery, and tea and coffee making facilities. Use of shared and common spaces in the office buildings, if you work in a shared building, such as the lifts or the stairwells, as well as the toilet facilities, hand washing facilities. All of these things need to be considered specifically in relation to the risk of COVID transmission. So once you've got your risk assessment, then what do you need to do with it? Well, there is a legal duty under the Health and Safety at Work Act to consult your workforce in relation to your health and safety arrangements. Now, this is something that we are seeing a lot of activity on at the moment. Trade unions are really pushing employers to ensure that the arrangements they have put in place to return to work are satisfactory. The consultation process has to be meaningful and it has to be two-way. So you need to put your draft risk assessments to your employees and or their representatives to check if they are happy with the measures. We also strongly recommend that you formally record this process in writing so that it can be evidenced if required further down the line. In addition, if you have premises in England and you employ more than 50 people, then you need to consider publishing your COVID risk assessment on your website if that's possible. Important to stress, this is not a requirement, but it is an expectation, quote unquote, of the government. And we have been asked by a couple of clients at the moment if publishing on their intranet is acceptable. Now, we've given advice that we think it's likely that that will be sufficient, given that the overarching aim is informing the employees as to the risks. Moving now to the consequences of breaching your health and safety duties. Well, hopefully it won't be news to anybody that failing to comply with health and safety duties carries some very serious consequences, both for corporate bodies, but also for individuals. COVID has brought that really into focus, and I'm going to look at it today from 2 angles. 1, what can happen if you breach the COVID-specific legislation? And 2, how general health and safety law might be used as a tool to punish those who fail to comply. So, Lynn has already touched on the different regulations in Scotland and England, and I'm not going to go into any specific detail there. But in terms of penalties, the sanctions and penalties are broadly the same north and south of the border, with a couple of very small differences. The 3 main headings are fixed penalty notices, prohibition notices, and prosecution. Fixed penalty notices can be issued by constables in circumstances where the constable believes that a person has committed an offence under the regulation and where that person is aged 16 or over. The fixed penalty notice when issued is £60, but that will be reduced to £30 if paid within 28 days. More than 1 fixed penalty notice can be issued to the same person in the event of repeat offending, with the amount of the notice doubling each time up to a maximum penalty of £960. Prohibition notices, which are something we're getting asked a lot of questions about at the moment. The regulations give a relevant person the power to issue a prohibition notice if they have a reasonable belief that a person is contravening the regulations and they consider that it is necessary and proportionate to issue the prohibition notice to prevent them from continuing to contravene the regulations. Now, a relevant person is defined as a constable or somebody designated by a local authority for the purposes of this regulations. So for example, we've seen trading standards officers being so designated for this purpose. And in England, the definition is slightly wider, and it also includes police community support officers. Now, it's important to highlight this is not a prohibition notice in the traditional health and safety sense. There is no means of appealing the notice once issued. One reason for that might be that certainly Police Scotland have stated that they will use their enforcement powers very much as a last resort. The idea being that suspected breaches of the regs will be dealt with by engagement with people and businesses in the first instance. And assuming that they receive an appropriate response, then there won't be an issuing of a notice. It's also not proposed that COVID prohibition notices will feature publicly on any register, as the ones issued by the Health and Safety Executive do. However, there is still the associated risk to business reputation and also loss of public faith in businesses who are seen to not comply with their duties during this difficult time. In terms of prosecution, the regulation also creates criminal offences for failure to comply. And they also detail the specific penalties that can be imposed if a person or a corporate body is convicted of a breach. If you fail to comply with a direction given to you within the regulations by a police officer or relevant person, or with an issued prohibition notice, then at that stage you've committed a criminal offence. Somebody who commits the criminal offence is liable on summary conviction to a fine not exceeding the statutory maximum, and in Scotland the statutory maximum is £10,000. In England, the penalty on summary conviction is also a fine, but it needs to be highlighted that there is no statutory maximum for summary fines in England. So for a company, this is potentially more significant, as it's likely that the standard sentencing consideration of an offender's means could see some cash-rich businesses facing potentially significant fines. So what about the existing health and safety laws? Well, a question that we are being asked by clients is whether companies who fail to comply with their health and safety duties in terms of COVID could face prosecution under the Health and Safety at Work Act. And it's a very interesting question, as we've already touched upon. Duties haven't been relaxed. And in fact, they have been extended, as we've touched on certain areas. So therefore, in theory, yes, there is nothing to stop a COVID-related health and safety breach where it's alleged that an employer has failed to ensure its employees' health, safety or welfare being prosecuted in terms of the 1974 Act. Now, that often prompts the follow-up question of, well, how are such cases going to be treated by the courts? At the moment, we can't say with any certainty, and I think we haven't focused in any of our previous sessions on the change in attitudes towards health and safety prosecutions across the United Kingdom in recent years, but now's a good opportunity to highlight some of what has been going on, just to give you an idea of what it could mean if the ball is dropped in terms of COVID. So traditionally, Scotland has been a more gentle sentencing jurisdiction. However, specifically with the view to health and safety cases, the Scottish Government and the judiciary are escalating it up the boardroom agenda rapidly and unapologetically. In 2016, the English and Welsh Sentencing Council published guidelines for the sentencing of health and safety offences. This saw fine levels quadruple in just a couple of years. And the reason for that, in part, was a switch from considering a company's bottom line profit or loss figure to looking to their turnover figure as the starting place for considering the ability to repay a fine. Now, these guidelines, although they do not directly apply in Scotland, have been given standing by the Scottish Appeal Court, which has commented that the guidelines may be used as a useful cross-check against the existing sentencing precedents. So as a result, fines here too have increased significantly. and reference to the guidelines by sentencing judges is now approaching the norm, unfortunately. In addition to the guidelines, Scotland has also seen the introduction of the Victim Surcharge Fund, which applies to offences committed since November 2019. These new rules mean that for all fines imposed, a surcharge applies and is collected by the Scottish Government. For fines in excess of £10,000, which will represent most health and safety cases, a 7.5% surcharge is applied. So in recent years, where we've seen the fines in Scotland creeping up in excess of £1 million in some cases, had the surcharge been in place at that time, those cases would have seen an increase in the level of penalty by £90,000 for one company following a fatality in the workplace. And remember too that fines are not insurable and require to be paid directly by the business. So it's very significant sums of money. There is a similar provision in England in terms of a victim surcharge fund, but the level is capped at a maximum of just a few £100s. So this does represent a very significant difference between the two jurisdictions when it comes to sentencing. For individuals accused of breaching their health and safety duties, there's the potential of a jail term. Now, I don't unfortunately have time this afternoon to go into the details of the different provisions, but it is worth mentioning that along with the other changes we've been seeing in relation to health and safety cases, the number of individuals being prosecuted is also increasing. In fact, in 1 year, it tripled. So we have seen the courts in Scotland imposing custodial sentences for individuals of up to 2 years. So it is quite a serious deterrent. As I've said, all of this is a result of a shift in government and judicial attitudes towards health and safety and the increased importance that they expect it to be held in the boardroom. But it's not just the criminal impact that COVID is going to have. There are going to be an increase in the civil claims, and I'm going to hand back to Lynn just now to discuss briefly that potential.
Victoria. Yes, so the final area we're going to have a look at is just the consequences of breaching health and safety in a civil context. I know from the sign-up list that some of you joined my colleagues' webinar that they had last week on COVID and the claims landscape, so I'm not going to repeat everything they've said here, and actually you can still listen to that webinar on our Brody's YouTube channel if you missed it. But what we do know is that we can predict there's going to be multiple types of civil damages claims that might emerge from this pandemic. Perhaps the most obvious is a claim for infection, whether that's an employee or a member of the public who's claiming that they've contracted COVID-19 either at work or as a result of interacting with a business. Whether such claims would be successful really will depend on the facts of an individual case, and employees are also going to have to be able to prove that the actions of the company caused them to cause the virus. And with multiple sources of infection, that may prove difficult. The changes in which people are working as a result of the pandemic also increase the potential for claims. For example, a significant proportion of the UK workforce is presently working from home, myself included, and so many are likely to do so for the foreseeable future. As Victoria's mentioned, this is presenting different risks which employers need to address so as to avoid claims for physical or psychological injury whilst employees are working home. Another area we see potential for claims is from businesses that have continued to operate during this pandemic, but due to matters such as either social distancing or isolation, it's resulted in them working with a skeleton staff, which has perhaps resulted in employees working at capacity for longer periods and potentially leading to fatigue, which also could have resulted in new recruits being onboarded quickly to fill gaps in a workforce. And if they've been provided with insufficient training or instruction to be able to carry out their job safely or competently, then that increases the risk of injury and the likelihood for claims. We've heard of many businesses diversifying the products and the services that they're providing as a result of COVID-19, many turning to producing face masks or hand sanitizer. I'm sure we can all list a number of companies in the press that have been doing that, such as Brewdog and Isle of Harris Distillery and Prada, just to name a few. Now, that can result in workers carrying out tasks which they don't ordinarily do, or them using equipment which they're not actually familiar with. And that again increases the risk for accidents. And so businesses do need to really consider the health and safety implications of adopting such changes. There's therefore significant potential for claims to arise as a result of health and safety breaches which have been caused due to the new risks that COVID-19 has presented. And so the culture of health and safety and that focus really needs to continue to be at the forefront of employers' minds. So to summarise, COVID-19 has introduced new risks for employers that they need to assess and control. There has been no easing of the health and safety obligations, and employers need to continue to meet those, notwithstanding the difficulties now introduced by this pandemic. So quite simply put, it's not going to be a defence to a breach of health and safety regulations that COVID-19 made something more difficult to comply. We therefore recommend going back to the basics. Know the law. The situation is fluid, and with new information coming from the government and new different guidance being issued regularly, it's important that you're keeping up to date with that. And given this fluidity, we really strongly recommend that employers are regularly reviewing any risk assessments they have in place to ensure that they are still appropriate and adapt them as necessary. So that concludes the points that we wanted to cover. Thank you very much for listening today. We do still have some time for questions, and I can see there are a couple on the Q&A. So I think, Victoria, have you got sight of those?
Yeah, I do. So there's a question here which I'll just read. The question is, if a company fully complies with the guidance, is that sufficient to demonstrate they've complied with their legal duties? Lynn, do you want to take that one?
Sure. Yeah, I suppose the brief answer to that is going to be, unfortunately, no. As I'm sure people are aware, blindly following guidelines doesn't necessarily mean that a business is just going to be off the hook. And it's impossible for these guidelines to cover every situation or eventuality. So businesses still need to consider the guidelines, but also apply their own judgment in terms of how they actually are applicable to operating their own business.
Yeah, absolutely, I agree. Another question here, who are the individuals who could be prosecuted within a company? Well, it's a good question. The short answer is that it's really anybody. There are different sections under the Health and Safety at Work Act which apply to different sections of a business. So under Section 7, everybody at work has a responsibility for their own health and safety, but also the health and safety of those that they are working with. Moving further up the tree in Section 37, that focuses primarily on supervisors, managers, directors of the company or company secretary. And that creates a specific offence if they fail in their obligations under health and safety as well. So it's a little bit of there's no stone unturned at the moment. I think one last question just now we should just be able to squeeze in, and that's a question about testing, Lynn, for you. Can you insist on your employees being tested?
That's also a good question. Well, a test is akin to a medical procedure, so it really does need an employee's consent. However, in terms of an employee's contract of employment, and we are sort of straying into employment law here, but there may be specific terms in that contract that requires them to consent. And also there are implied terms in contract of employment that employees have to comply with reasonable requests or instructions. And in the current climate, it may be feasible for an employer's request for an employee to submit to testing to be considered to be reasonable. And just as Victoria has touched on there, you know, every employee has duties in terms of safeguarding the health and safety of their co-workers. So you could envisage a situation where it would be unreasonable for an employee not to consent to the test, but in short, they do need to consent for the actual procedure to be carried out.
Great, thanks, Lynn. Right, well, we are about to run out of time, so thank you again very much, everybody, for logging on today. Our contact details are there. If you have any questions that you'd rather pick up offline, please do feel free to get in contact, and we hope to see you all again soon on another webinar. Thank you.